Welcome back. Earlier today, White House coronavirus task force members testified before the House Energy and Commerce Committee. The hearing was held as the country faces an uptick in cases. 26 states have seen an increased number of cases over the past 2 weeks, and 7 have seen a spike of 100% or more. As we mentioned earlier, Arizona, where President Trump is speaking right now, reported a record single-day increase. It also set records for the number of people hospitalized in intensive care and on ventilators because of the disease. Texas also reported a record high with over 5,000 new cases. And just a few hours ago, the governor of Texas, Greg Abbott, urged Texans to stay home to help fight the rampant, his word there, rampant spread of the disease. In his testimony today, Dr. Anthony Fauci called the recent uptick disturbing.
If you look at how we've been hit badly. I mean, anybody who looks at the numbers, we've had now over 120,000 deaths, and we've had 2.5 million infections. So it's a serious situation. In some respects, we've done very well. However, in other areas of the country, we're now seeing a disturbing surge of infections that looks like it's a combination, but one of the things is an increase in community spread. And that's something that I'm really quite concerned about that.
And while that hearing was going on, President Trump contradicted Fauci. He tweeted this, quote, "Cases up only because of our big number testing. Mortality rate way down." Health experts have said that a large share of the new infections are among people in their 20s and 30s. Fauci urged young people to remain vigilant and cautioned against a false sense of security.
What you can't forget is that if you get infected and spread the infection, even though you do not get sick, you are part of the process of the dynamics of an outbreak. And what you might be propagating inadvertently, perhaps innocently, is infecting someone who then infects someone who then is someone who's vulnerable. That could be your grandmother, your grandfather, your sick uncle, whom have you, who winds up dying. So it's a very difficult messaging when people say, I'm young, I'm healthy, who cares? You should care, not only for yourself, but for the impact that you might have on the dynamics of the outbreak.
And for more, I'm joined by Dr. Lipi Roy, internal medicine physician and an MSNBC medical contributor. Doctor, thank you for joining us. So give us a sense. We focus so much on the raw case numbers. It looks like there's particular concern. I was looking through it today. Arizona, Texas, Florida, California, these seem to have the biggest spikes in multiple categories. What's your sense exactly of what's going on here?
Yeah, good evening, Steve. It's multiple reasons, right? Where for some places they opened up a little prematurely, or they frankly never closed down. They're not really implementing widespread testing or contact tracing. Remember, Memorial Day, there are a lot of factors that are really taking place here. But, a couple of points I want to point out from the congressional hearing. We absolutely need more testing. And to Dr. Fauci's point, the testing doesn't really cause more cases, right? It's simply picking up or detecting what's already out there. And as you pointed out, Steve, Arizona, Texas, various places, Florida, we're seeing this, to quote again Dr. Fauci, disturbing rise in cases. And we know, again, that these are real numbers because of the percent positivity in the cases, or in the tests rather, and the late indicator, but very accurate one, is the fact that hospitalizations and ICU bed admissions are all going up. Those are really accurate indicators that this is real.
Well, let me bring in as well Lonnie Chen. He's a fellow at the Hoover Institution. Lonnie, you were originally scheduled to join us at the top of this segment. I guess we were having some technical difficulties, but welcome, because I was hoping to have a discussion between the two of you. I'm glad we got that up and running. And Lonnie, we were just talking about the rise in new cases. We're seeing a particular spike in some states, Arizona, Florida, Texas come to mind. I wanted to talk to you about another piece of this, because I know this is something you've written about. It looks like the new cases, a lot of the new cases, at least, we're seeing younger people, 20s and 30s. I know you have written about trying to reopen the economy by taking into account that risk varies by age. Can you talk a little bit about how you think of the new increases right now, the fact you've got a lot of young people, and how you think that should be factored in policy-wise?
Well, it is a factor. I would just say that I think one of the things, fortunately, that we're seeing is that because it is a younger population, thus far at least, we aren't seeing a steep increase in deaths or even hospitalizations in some parts of the country. So I think that's a good thing. But I do think, ultimately, this is going to be a story of risk assessment. People are going to have to figure out what is their risk tolerance? What is the amount that they are willing to take on, the people around them are willing to take on? And that calculus is going to differ from jurisdiction to jurisdiction, perhaps even on a family by family level. But what is the case is that as this goes on, as we learn more about this virus, hopefully we can deploy and use that information so we can help people make educated decisions about whether they want to go back into the workplace, whether they want to resume a more normal situation or not. Because in the absence of that information, that's why, by the way, testing is important, contact tracing is important. Once we have all that information, people can make a more educated decision.
Well, Dr. Roy, right now, in all 50 states, we've got some form of reopening going on, so people can make a lot of those decisions that Lonnie's talking about. So in terms of risk assessment, what would your practical advice be to folks grappling with those kinds of decisions?
Yeah, and these are realistic concerns. From the public health standpoint, we've been seeing for all along that, opening up the economy and public health are not two mutually exclusive phenomena. We can do both safely, systematically, making sure that the businesses, have a proper preventive health measures in place. I just got my haircut today. It was phase 2 in New York reopening. But you know what? They kept distancing. Almost, I think, every single person there, including myself, wearing masks. So this can be done safely and appropriately. And the other key, though, is messaging, Steve. If you saw from the hearing, every single health official there, the news was pretty serious. It was firm, sometimes grim, but it was consistent. They all said the same message again and again about testing, about preventive health measures, about vaccines. All these things are going to be really important, but the message has to be consistent. And to Dr. Fauci's point, he said, I wear a mask for myself, for others, and to set an example. That's what's key.
Yeah, and Lonnie, I'm curious. I don't know if you heard it. We played that clip from Dr. Fauci, though, talking about, if you're young and if you're healthy and maybe you're not at great risk for this, he's basically making the point that you could come into contact with someone who is. And I think that's a piece of this I'm trying to figure out. From a policy standpoint, is there a realistic way to keep the folks who are vulnerable protected and insulated from this reasonably, not to have that risk of exposure from younger and healthier people? Can you have two things going on at once?
Well, yeah, certainly with respect to those individuals who are, for example, in long-term care facilities, so skilled nursing facilities, nursing homes, we need to be engaging in extra precautions to make sure that those facilities are especially safe. That means restrictions on visitations, ensuring that staffing is consistent and we don't have staff necessarily maybe going from one facility to another, taking the coronavirus with them from one place to another. That is one thing that was really unfortunate in the early part of this outbreak in particular, is that we didn't do nearly enough to protect our most vulnerable seniors. So that's one thing. With respect to the workplace, people are going to have to make educated decisions about, for example, if they have a high-risk member of their household, if they have an older member of their household, they will not be able to go back to work, go back to situations that as they were before the coronavirus. And people are going to have to recognize if they have members of their household that are at higher risk, they are going to have to take extra precautions. That is simply the new normal we live in now.
And Doctor, there also was that issue today that came up, Dr. Fauci saying a vaccine perhaps by the end of the year, early next year. What's your sense of that potential timetable?
Yes, Dr. Fauci said that there are many vaccines that are being investigated globally, but there's one in particular that's going to be entering phase 3 clinical trials in July. That's next month. Really promising. Again, it's not going to be ready for prime time, so to speak, until next year, 2021. The other key, though, to remember, speaking of vaccines, though, Steve, is that remember Dr. Redfield reminded us all about the flu season coming in September, and the flu vaccine will be available September, October. He said he urged us all to get the flu vaccine and, quote, this will be this single, in fact, his quote was, this single act will save lives.
Yeah, I think people might be a little bit more diligent about that flu vaccine this year. Dr. Lipi Roy, Lonnie Chen, thank you both for being with us. I appreciate that. And still ahead, Joe Biden is enjoying a solid lead in national polls. Of course, Hillary Clinton was also leading Donald Trump at this point in 2016. Is it different this time? What does it mean? We'll be right back.